And in 2021, there were more than 18,000 cases of domestic violence reported in San Diego County, according to SANDAG. Now, critics of this bill say that getting rid of mandated reporting would reverse decades of progress.
I share my story because I lost my mom to it. I grew up in it. I lived it, and I almost lost my life to it.
Isabel Rosales is a survivor of domestic violence. For more than 15 years, she endured abuse at the hands of her husband, who nearly killed the mother of three in January 2018.
He snapped and he stabbed me, and I ran into my kid's room, hoping that maybe because my kids were there, he wouldn't harm me, and yet he still did.
Medics rushed her to UCSD Medical Center, where doctors asked her who had attacked her. She pointed out her husband.
I wanted him to finally have to pay for what he's done for so many years.
Under current state law, healthcare workers are required to report suspected domestic abuse to law enforcement.
Regardless of what I wanted, they were going to proceed with the charges.
A move that Rosales says transformed her life. Ultimately, her husband was sentenced to 23 years in prison, and she has become a trained domestic violence counselor. In Rosales' case, the law worked as intended. But some victim advocates say this is not always the outcome. They're pushing for the passage of Assembly Bill 1028, which would no longer require that healthcare workers report suspected domestic violence abuse to law enforcement.
As a survivor myself, I think that what that does by getting rid of that is it gives survivors more options.
Diane Gald is with the California Partnership to End Domestic Violence, which, along with dozens of other organizations, is supporting this bill. She says that while victims would still have the option of having doctors report the abuse to police if the victim wishes, this new law would allow the victim to decide which course to take, giving them more autonomy.
Survivors are the best ones to know what's going to help them or hinder them.
This is for safety.
Assemblymember Tina McKinner wrote this new bill, which she says is more victim-centered. She says that by eliminating mandated abuse reporting, victims who need health care will be more willing to access it without the fear that law enforcement will automatically be notified. She says victims of color and those from immigrant communities are particularly vulnerable.
They may not even get picked up immediately, and they find out that they got reported. It can make the situation worse at home.
Instead, under AB 1028, healthcare workers would refer the victim to available resources, from counseling and cash assistance to transportation and emergency shelter.
Now, will they still use it? We don't know, right? We don't know for sure, but it won't just be handing them to the police and then just letting go from there. Because I'm sorry, law enforcement just don't have the experience to take care of these domestic violence victims.
If AB 1028 passes, more women are going to die in the state of California.
Former San Diego City Attorney Casey Gwynn, who prosecuted more than 10,000 domestic violence cases before leaving office, wrote the current law, which has been in place since 1994. He's a founder of the Family Justice Center, which provides comprehensive services to abuse victims.
When AB 1028 passes, the message that will go out to abusers is, if you adequately threaten and intimidate your victim, she won't call the police. They're drawing a target on the victim's chest.
Locally, District Attorney Summer Steffen and City Attorney Mara Elliott have voiced strong opposition to AB 1028. Gwynn says it's unrealistic to expect victims to seek help after receiving a referral to services.
The statewide survey that was done in California in March actually found that the majority of advocates and survivors support current law.
I know this is a hard decision for a lot of the legislators.
And as the state legislature weighs its decision, survivor Isabel Rosales believes the decision made for her to report the abuse was, in her situation, ultimately the best one.
It takes a community. We can't do this alone. I could not have done this alone.
And under this bill, injuries caused by firearms would still be required to be reported to law enforcement. Also, child abuse and elder abuse victims would not fall under AB 1028. At this point, the Assembly has passed the bill. It's now in the hands of the state Senate.